Well, hello, and thank you for joining me on this presentation entitled Stroke Prevention and Education. My name is Dr. Robert Bartosh of Proactive Wellness and Injury Center, and we always make an attempt to share information that will help the listener and or our patients achieve the best performance of their life. And this is no exception. Stroke is a very, very important situation, a disease, a condition to talk about. Right now in the United States, it's estimated that there are well over 800,000 people a year that have strokes in the United States, and of those, over 150,000 die from them, and many of them are, they remain hemiplegics or paraplegics as a result of the stroke. And that is a terrifying, those are terrifying, I should say, statistics, many of which needn't be, because stroke, over 80% of all strokes are preventable. So our goal in this is to teach you what strokes are, what the types are, how they're caused, and what you can do to prevent them. So thank you again for joining me. Let's go ahead and proceed. So the first question we have to ask then is, what is a stroke? Well, a stroke happens when the blood flow to an area of the brain is cut off. And that's very simply put. Now the blood, you have to understand, carries with it oxygen and nutrients to the cells, to all the cells of the body. And when those cells of the body aren't able to have the oxygen and the nutrients they need, they die. And this is exactly what happens in the brain. Those brain cells literally die. Now, a stroke is a medical emergency. You must understand that. And it's vitally important to get treatment as soon, as quickly as possible, because some of the treatments only work, and the best prognosis is only achieved if the treatment is given within the first few hours of the individual suffering from a stroke. So a delay in the treatment can increase the risk of permanent brain damage and, in many instances, even death. And we don't want that to happen. So with that in mind, I wanted to share with you an acronym here, the ACT FAST, F-A-S-T, and explain how you can identify if an individual that you're with is having a stroke, and even if you are in the throes of experiencing a stroke. All right? So these are the first 4 major signs. Now, there are other signs that I'll talk to you about, but these are the first 4 major signs that you should be aware of and would enable you to recognize a stroke that is occurring. The F then, it's face dropping or drooping. And what you simply do is ask the individual to smile. If you're in doubt that the person is having a stroke, ask him or her to go ahead and smile. And if they have an inability to do so, if one side of the mouth rises up and the other side drops down, that is a sign or an indicator. The A, arm weakness. Ask the person to raise both arms above their head. And as they're doing it, if you're seeing one arm is drifting downward while the other arm is ascending upward, that also is an indicator. Then we move on to the S, the speech difficulty. Ask the person to repeat a simple sentence. Mary had a little lamb. And listen to the words. If they're slurred, if they're sloppy, if the person is unable to do that, that too is another indicator. And when these happen, it's time to call for help. Now, I want you to understand that if the person has any one of these signs, you don't have to have 3 out of 3. Any one of these signs, immediately contact or call 911 or your local emergency hotline. It's imperative to do that. And even in yourself, if you're in a situation where you experience an inability to articulate, to speak, if you're moving around and all of a sudden one of your extremities, one of your arms or hands gets very, very weak and you're unable to lift it up, and or your speech becomes very, very slurred, it is time to alarm someone that's near you, or press the button on your phone and dial 911 quickly and let them know where you are. Because as I said a few moments ago, speed is of the essence. You want to move as quickly as possible in this situation. Now, those are the fundamental signs, if you will, of an individual having a stroke. But there are more symptoms that you can look for. So the ones that we just discussed, those are the most common symptoms of a stroke. But some others are numbness and or weakness of the face, the arm, or the leg. Numbness of the or weakness, as we talked about a few moments ago, in the face, the arm, or the leg, and especially if the weakness is experienced exclusively on one side of the body. And by that I mean if they're having numbness in the face and the arm and the leg on the right side, or the weakness on the right side, that definitely is a sign of a stroke that is occurring. Or if there's confusion or trouble understanding other people, again, the person that you're with or you yourself. We talked about the difficulty in speaking. Also, trouble. An individual has trouble seeing with one eye or both eyes, or they have problems walking or staying balanced or coordinated. Or if you, again, they apply to you, the listener, as well. And or dizziness and the severe headache that comes on with seemingly no apparent reason. Those two are symptoms or indicators that a stroke is occurring. And again, I want to reiterate and repeat that you don't need all of those signs or symptoms to determine that it's a stroke, any single one of them. And in this, I want to remind you that every minute counts. It's much better to err on the side of being too cautious than not enough. So calling a doctor is not the way to go. Driving to the hospital, taking the individual that you think is having a stroke, driving them to the hospital is no way to go. What you want to do is dial 911. You want to contact your ambulance or your EMT people and get them there as quickly as possible, because they have the vehicle, they have the materials, they have the knowledge that is necessary to address this situation. So if you have if you or anyone that you're with have any of these symptoms that I've shared with you here, just dial 911, call the ambulance, don't be a hero. And as I said a few moments ago, if you're not sure, it's going to be better to be safe than be sorry. So, you want to err on the side of being too cautious than not enough. Okay? All right. So now that we've laid that groundwork, let's talk about the different types of strokes. The first of which that I'll discuss with you is ischemic stroke. There are three main types of strokes, three different ones. And the first, as I said, that I'm going to talk about is the ischemic stroke. And it's also known as the stroke that's caused by a blood clot. And I'll clarify that as we go on. And this particular stroke that is caused by a blood clot is actually the majority of the strokes that occur throughout our country. Over 87% of all the strokes that occur are of ischemic in nature. And this stroke occurs when there's a fatty deposit that builds up inside the walls of a blood vessel, and it starts to obstruct the blood flow. And what happens is it just gets bigger and bigger and bigger, and it shuts off the blood flow to the area, so much so that there's no longer any flow or nutrients, oxygen getting to the cells, and then they start to die. All right? So with these types of obstructions or strokes, there are basically two types of obstructions now that cause an ischemic stroke that occur. The first of which that I'll talk about is called a cerebral thrombosis. This is one type of the obstruction. And what happens is this occurs when a blood clot forms in the brain's blood system, circulatory system. Now, a thrombosis is just a 25-cent word that means clot. That's what that means. Cerebral means that there's a clot now in the brain, in that area, and it's cutting off the blood in these tiny little vessels around the brain, and that prevents the blood flow from getting into the cells of the blood. And as a result, now those cells break down, and these vessels break down, and they start to, as the cells die, they burst open, and the blood starts to leak into the brain. And when the blood leaks into the brain, it's called a hemorrhage. You have a cerebral now hemorrhage. Now, the type of stroke, this type can happen in people of all ages. That is something that you want to hold on to. That is a very important point that I want to make. It can occur and happen in people of all ages. Unfortunately, most of our society thinks that these types of strokes only happen in the elderly. That's not true. In the elderly, they usually happen around the age of in the 60s and older. That can happen then. But however, we are seeing, as a matter of fact, in the last 2 decades, we're seeing an alarming increase in the amounts of strokes in young people. And by young people, I'm talking about middle school. I'm talking about children that are 7 to 12 and teenagers and college age young people. We're seeing an increase in that. So don't think for a moment that this stroke is only relegated to the elderly, because it can happen again in individuals of any and every age. That's a cerebral thrombosis. Now, there's also a cerebral, again in the brain, an embolism. It's an embolism. This is an obstruction that happens in the brain. And what happens, it basically is this, that there's a blood clot that forms in another location in the circulatory system. Now, the circulatory system means all of the blood channels in the entire body. So you can have a blood clot that forms in a leg, in the lungs, in the heart, and what it does is it'll break loose and it goes up into the brain. However, even though you can have that, the cerebral embolism is usually and primarily caused by a clot that's in the heart or the large arteries of the upper chest or the neck. That's what happens. It'll occur when a part of the clot breaks loose. It enters into the blood system, and then it goes up into the big arteries of the neck, and then it attempts to go up into these small, tiny vessels that are in the brain, and it blocks them, stopping the blood flow to the brain. And this is really interesting that you need to know that a leading cause of embolisms, what primarily causes embolisms to form in the first place, is that of an irregular heartbeat. So, and this occurs primarily in females. And unfortunately, females, just like their male counterpart, we kind of dismiss things that are happening in our bodies. But if you are experiencing irregular heartbeats on a regular or irregular basis, it behooves you to go into your cardiologist, your primary care physician, and have that checked out, because irregular heartbeats are the primary cause of creating embolisms. And what happens is when that clot gets large enough, it can break away in the heart, and it is pumped up in through the arteries up to the brain, and it will block off those vessels and create a stroke, a cerebral stroke. All right. So speaking of the strokes, there's a hemorrhagic stroke. The hemorrhagic stroke accounts for about, we talked about the ischemic one, and that's over about 87%. This one is about 13% of the time. We have the second type is the hemorrhagic stroke. And it's caused by a weakened vessel that just basically ruptures and bursts in the brain area, and it bleeds into the surrounding tissues, and it accumulates. So you have a slow leak, and it builds up, builds up, builds up. It's increasing pressure because of the amount of the blood fluid there. And then as that occurs, why it starts to kill off the brain tissue, the brain cells, and also stops the nutrients and the oxygen from getting to those brain cells, and they die. Now, there's two types actually in this one now of the weakened vessels, see, that cause the hemorrhagic strokes. One is called an aneurysm. Yeah, I'm sure you're familiar with that term. And the other one is anterovenous malformations, the AVMs. Now, the most common of these two, of course, is the aneurysm. And it's actually this stroke, the primary causative factor in this type of stroke is uncontrolled high blood pressure. Uncontrolled high blood pressure. That's what usually is the instigator of a hemorrhagic stroke. So when we're talking about this, we talked about those weakened blood vessels that in the brain. So first we're going to talk about that cerebral aneurysm. It's also known as a weakened blood vessel. That's basically it. It's a very weak area in the blood vessel, and it usually just enlarges. And I'm sure that you can picture something like that. You've seen water hoses or something that blow out, or different things that kind of expand and they lose their integrity and they start to get bigger and bigger. And it's often that expansion is called ballooning. So just like a balloon, you know, if you continue to blow a balloon up and it expands and expands and expands, inevitably it's going to pop. Well, this is what happens in these blood vessels. They get ballooned, they become weaker and weaker as they're stretching, and then they burst. And people they're not usually born with these, but they can form, they can develop, I should say, because of infections that the person has had. They can develop because of the use of amphetamines or cocaine. They can be a result of a concussion or a trauma to the head. And people, unfortunately, you know, they dismiss these bumps on the head as not eventful. However, because of that, it can be the cause of a rupturing of blood vessels in the brain area. So with that, if you start to experience recurring headaches, especially if it's over one area of the head repeatedly, it would behoove you to, again, contact your primary care physician and have him or her send you through the proper channels so that you can have that checked out. Because if one aneurysm forms, there's about a 20% chance that at least another one is going to form as well, because see, there's a weakness that's developing, that's kind of being promoted throughout the entire vessel, and that's what's happening here. And understand that small aneurysms really many of them don't have any symptoms when they're small. But as it starts to get bigger and bigger and bigger, like I said a few moments ago, it can produce the headaches, especially if you're having them occur repeatedly over one area. And as it expands, it creates pressure on the healthy part of the brain and the nerve tissues, and slowly but surely, it's going to destroy them. Okay, so that's a cerebral aneurysm. Now, the second one that I talked about was the arteriovenous malformation, the AVM. Now, this is something that people are born with, actually. It develops, and it affects the small veins in the brain. They become very tortuous or twisted, and because of that tangling of the blood vessels, the blood is taken into the brain, but it can't be removed from the brain. It's not eliminated properly, and you just get some bad blood that continues to build up inside the brain because of this inability to pump in and flush out. And these types of malformations, they occur in less than 1% of the population. And they're more common, actually, though, in females. Of the two, the male and the female, that happen more often than not in the females. And usually, as I said a few moments ago, someone is born with it, with the AVM. But I want to let you know that they're not inherited from the parents, and they won't likely be passed on in the children of individuals that have these types of malformations either. All right. Now, a few moments ago, I mentioned the event that we call high blood pressure, and it causes these strokes too, especially if it's not controlled. So understand that as the heart beats, what it's doing basically, it's pumping blood around the body, all through this network of vessels, the circulatory system, the arteries, the veins, the venules, the capillaries, and all on and on it goes. And what it's doing is it's feeding and fueling all of the organs, all of the muscles, all of the tissues, so they get the energy and the oxygen that they need to continue to live, to function. Now, as the blood then travels through the arteries, those are the big giant pipes of the circulatory system, it's going to push against the walls. And as it's pushing against the walls, the strength of the pushing, I should say, is called the blood pressure. That pushing against the walls of the arteries, that's the pressure that's being exerted by the heart as it's pushing the blood through those arteries. So as your heart squeezes and it pushes your blood through the arteries, your blood pressure is going to go up. That's going to be that top number that you get when you go to the doctor. And then as your heart relaxes, as it releases that push and it returns back to the beginning, it's going to open up. The blood pressure is going to go down. That's when the heart fills up once again with blood. That's when your pressure is going to go down, and that's the bottom number. So with each heartbeat, your blood pressure is going to rise to a maximum, and then it's going to fall to a minimum. The duo, then, those two numbers, those are shown as the number, the one number over the other, as I explained just a moment ago. And that translates into the reading that you get at the doctor's office when he or she says, well, you know, Miss So-and-so or Mr. So-and-so, you've got your blood pressure is 120/80. That 120 is the pressure of the heart, the power of the heart pushing the blood against the arteries. And then the 80 is when the heart is relaxing, and that's the minimum there. That's the 120/80, okay? That's how the heart is transporting the blood through your system. Now, high blood pressure, it can significantly increase your risk of hemorrhagic strokes, because it means now that your heart is under more stress and working harder to transport the blood. So instead of being, we'll say 120/80, a person's blood pressure might be 180/80. So there's a lot more work that heart is doing to push that blood through. It's just pushing it and pushing it. That means it's trying to push more blood through those smaller vessels. They have a limit, if you will. They have a limited capacity as to how much blood they can carry with each beat. So the stronger the beat is, the more blood is being pushed up there. And if they push up too much, you know, that can burst those little blood vessels. And that basically is what happens, see? Now, men, especially the elderly and people who smoke. Now, I'm not talking about just elderly men, but I'm talking about men in general, older people, that is male and or female, and people who smoke, or people that regularly drink alcohol. Those are the types of people that will develop or have a greater potential of developing high blood pressure. And believe it or not, young ladies that are on birth control pills, those types of things. Now, when you couple that, if they develop high blood pressure, they are at a very high risk then of having a stroke. So let me repeat that. Men in general that are deconditioned, don't take care of themselves, not eating properly, are starting to get overweight, are sedentary. I'm just expounding on it so it's clear to everybody who's listening. The elderly, many of which are become sedentary, don't eat, can get overweight, and whatnot. People who smoke, people who imbibe, they drink, you know, they consume alcoholic beverages on a regular basis. People, young ladies that go from one birth control pill to another, those individuals have a greater propensity to develop high blood pressure. And when that high blood pressure happens and continues, that puts them at a risk of having a stroke. So with that, let's move on to another issue. It's called the TIA, or the transient ischemic attacks, okay? They're also known as mini strokes because that's basically what's happening. And a TIA, a mini stroke, I want you to know it's a major, not a minor, it's a major warning signal that your body is not functioning where it needs to be functioning. And I'm telling you, a full-blown stroke is imminent. If you are an individual who's gone to your doctor and they're telling you that you're having TIAs, and don't worry about it now, I'm telling you that what you need to do is to find another doctor, and find another doctor quickly, because TIAs are major warning signals that the body is letting you know that if not addressed, if not corrected, if not eliminated, stopped, they're going to result in a full-blown stroke. And that's, you can take that to the bank. The TIA then, it's going to occur from a temporary blockage of blood flow to the brain. So temporarily, for whatever reason, there's a little particle or some fat deposit or whatever it might be, an obstruction in the blood vessel. The body fights back and it quickly pushes that little thing out of the way, and then the attack is over. And the body many times uses what we call natural clot dissolvers. So it's going to put out some enzymes that are going to break that tissue down so that the blood can now flow through there. It's like Drano, if you will, for small blood vessels. Okay, the body's Drano to clear out the blockage. So the blockage isn't going to be there in place long enough to do any permanent damage. But understand, the causative factor has not been addressed, and these things are occurring over and over and over. Now, here's some things that you need to know about the TIAs. The TIAs, these transient ischemic attacks, they happen before about 15% of all the strokes. Of all the strokes that we have studied and researched and have on record, about 15% of them, 15 out of every 100 of them, they happen right before a major stroke occurs. And then 1 out of 4 of those people who have a TIA, they, and this is sobering, they die within 1 year. Because as I told you before, the TIA is a major warning signal that a stroke is imminent. And you have to understand, with every successive TIA, every successive attack, that body's getting weaker and weaker and weaker and weaker until, boom, the big one hits and the body has nothing left, and that person dies. And about 1/3 of the people, 1 out of 3 people that have the TIA, if they do live, they go on to have a more severe stroke within the year. So, they have a stroke and they come away, they're hemiplegics, they're paraplegics, they're paralyzed. They didn't die. And I don't want you to think that everything is fine now after they had their stroke. They have some serious residual from the stroke. And those people, if the problem isn't taken care of, they also die within a year. They have a major stroke, a very severe stroke, because that body then is severely challenged. It's severely damaged. Okay, so nothing here to just ignore. So with that, after the stroke, the TIA becomes more prevalent. I told you that 1 out of 3, they die. They have a more serious one. So anyone can have a transient ischemic attack. But the risk of that increases. The risk of these occurring now, they increase with age. And if a person has previously had a stroke, they are definitely have a greater potential of having them. And you have to pay careful attention to the warning signs, which are the same as a stroke. They're the same. So a person that's having a TIA and that's becoming more and more prevalent, and they have these after a stroke. So I can be as clear as possible. A person has a stroke and everything is kind of returned to a state of normalcy, as good as it can get. Everybody, their alarm signal shuts off. Everybody goes back to living the way they were. They're dealing with the results of having a stroke, and life goes on. But this person who has the stroke now, they're having TIAs, and they're becoming more and more apparent, more pronounced, but they're starting to dismiss them again. Look, that person can have remember the acronym, the FAST. They can have the facial drooping. They can have the inability to raise the arms up. They can have the effect of the inability to speak, to enunciate clearly. Those things start to happen, and you've got to know that you've got to get them care as quickly as possible, because those are signs that there is that severe stroke that I was speaking about in the previous slide. So that's what you need to do. You never, never, never want to dismiss these things. See? So now we talk about genders in stroke. Remember I told you the females and the males and how it is? Well, 1 in 5 women in the United States, statistically now, what's going on is 1 in 5 women will have a stroke in their lifetime. 1 out of every 5. And a stroke will actually kill twice as many women as, now listen, as breast cancer. A stroke is going to kill and is killing twice as many women as does breast cancer. And I've got to tell you, you may wonder why we're not letting people know more about this, or why there aren't marches, women's marches for strokes, or some kind of foundation they're supporting. And the fact is, breast cancer is much more marketable. It's much more financially lucrative as a disease than is stroke. And that's my opinion. So, but the fact still remains that stroke kills twice as many women as breast cancer does, and it makes it the 4th leading cause of death for women. The 4th leading cause of death for women. Stroke kills about the same number of men each year as prostate cancer and Alzheimer's disease combined. But you're not hearing about that either, about the guys. See? Well, the big deal is the prostate cancer and the erectile dysfunction and the whole 9 yards. And still here, stroke is killing twice as many men as prostate cancer and also Alzheimer's disease combined. So these stats, they really come as a shock to most people, and perhaps you as well. But the good news is that 80%, as I said early on in my presentation in this, over 80% of other strokes are preventable. So, and we're going to get to some steps that you can take in a few moments. But first, what I want to do is to talk about what puts some women at more risk than others, because that is an issue that has to be dealt with. And if you are a female listening to this, listen. High blood pressure, that's one thing, because 1 in 3 women have high blood pressure. And remember, we talked about high blood pressure and its ability to promote stroke. 1 out of every 3 women now has high blood pressure. Can you do something about that? Absolutely, positively. You can actually rid yourself of having high blood pressure for the rest of your life. And only about half of those women that have high blood pressure, though, really have it under control. They just think that by taking the medication that the doctor gives them, that's controlling it. It's not controlling it. What it's doing is it's just subduing it for the time period. Then the person has to graduate to more pills or a higher dosage or a totally different medicament in order to deal with it. And as I talked about a few slides ago, also there's certain types of birth control pills, especially so certain types that really play a major role in a female developing high blood pressure, which can result in a stroke. And look, this starts when the young lady is put on the birth control pill at the age of 11 or 12 or 13 or whatever age she gets on it, and then they have a history of being on birth control pills for years you know, I want you to know that the seed for high blood pressure, for having a stroke later in life it's been planted at that time. I want you to be aware of that, okay? So in gender, that's what we're talking about, because women are far more affected. It's the fourth leading cause of death. It kills more women than breast cancer does. And it's sad that more women aren't taught about this, that you don't know about it, that it's basically, for all intents and purposes, it's ignored, and it's allowed to destroy these lives as it is. But we're going to do something about it. I'm going to educate you here in a few moments. But before we do that, we're going to talk about race and stroke, because that's another issue. Black Americans, African Americans are more likely to have a stroke than any other group of women in the United States. Now that we're talking about the women too, the Black woman has a higher potential of having a stroke than a white woman, than an Asian woman, a Mediterranean, whatever it may be. Of the Caucasians and the Mongoloids, the Negroids have the highest potential or percentage of having strokes than their counterparts. And they're also more likely to have strokes at a younger age. So what I'm saying here is that a young Black woman is at a greater risk of having a stroke than her counterpart, than her white or Caucasian or Asian friend is. That's also a fact. And it could be part of the, you know, the failure of individuals going to the doctor and getting, you know, evaluated or whatever. It certainly does result because of high blood pressure, because of obesity, because of diabetes. All of those things are going to add up together to lead to a stroke. So compared to their non-Hispanic whites, Hispanics also have strokes at younger ages. So compared to non-Hispanic whites, Hispanics have higher strokes at younger ages. While the average age for stroke among non-Hispanic whites is around 80 years old, among Hispanics living in the United States, they start to have the strokes at 20 years earlier, around in the 60s. And we really don't know why. I'm certain lifestyle, attitude, education, usage of medical facilities or whatever has a lot to do with it. And look, I want to stop and say something, because I want to go back to a point that I made. If a person is sedentary, if they are overweight or obese and diabetic, they are a ticking time bomb. In our society, unfortunately, because of this garbage called political correctness, and this is my opinion, we have embraced overweight, and we have celebrated people being obese. I am beautiful, look at me, I'm embracing my beauty and whatnot. That's a travesty. We as a medical profession that have sworn to educate and care for people, we have dropped the ball. We have got into the political correctness arena. When I say we, I'm not including me. And we have not sounded the alarm for people that are overweight or obese. We have just let them go their way, and we have managed diabetes, or we have managed high blood pressure, or we have managed the obesity. That's like managing your house when it's on fire. You call up the fire department when you have a room that's on fire, and they're going to come and manage the fire. Well, what the? You don't want to manage a fire, you want to put it out. That's what we want to do. So what am I saying? I'm saying this. If you're overweight, if you're obese, and you have diabetes, or if you're diabetic, you are sick. You are a sick person, and your body is screaming at you and letting you know that there are problems within that have to be dealt with, that if not, will inevitably result in a serious problem that you'll have for the rest of your life and or death. And that's the bottom line. That's the bottom line. And look, I know I'm getting off course here with this, but if you want any help, if you have any other additional questions about this, please feel free to contact our office. I'll direct you to doctors that can help you, or I'll direct you into our office as well, because that's what we do. We help people. So anyway, the race and the strokes. Okay, so now I want to talk about prevention. Okay, we want to prevent something. High blood pressure can double or quadruple your stroke risk if it's not controlled. Let me repeat it. High blood pressure. If you have high blood pressure, it can double, it can quadruple your stroke risk if it's not controlled. And it's the most significant contributing factor to risk in both men, women, black, white, Hispanic, doesn't matter, and also whether they be old or young or in between. High blood pressure can double or quadruple your stroke risk if it's not controlled. Your ideal blood pressure, the goal should be less than 135/85, okay? But for some, a slightly higher goal may be more appropriate. Now listen, this is a very vague statement I'm saying, because you as an individual are unique. Your lifestyle, the activities that you engage in, everything is specific to you. Your body is going to respond to those influences specifically. So what you need to do is to see your primary care, to see a doctor who will take into account all of those things, who will do some follow-ups regarding your blood pressure, and he or she can determine what's right for you. Because again, according to the majority, and I've seen this through my 30-some years of practice, your blood pressure should be less than 135/85, and for some, it might be slightly higher, but it depends on the individual. So that's something that you have to assess and determine with your physician. Now, to reduce your blood pressure, though, you want to, of course, reduce the salt intake. And the salt that I'm talking about is the salt that the table salt. I'm not talking about what I recommend to our patients is Himalayan pink sea salt. All right. But anyway, if you're not eating that, because that's a totally different animal, so to speak, than the table salt is. So if you're eating regular table salt, and you're doing it more than half a teaspoon a day, you've got to reduce it, because that's holding water. That's creating problems, not only in that realm, but it's also causing your body to lose many, many essential minerals that it needs for its function. You also want to avoid high cholesterol foods like red meats, fried foods, cheese, and ice cream, okay? You want to avoid, I should say, not eating so much of it, because we become creatures of habit, and we repeatedly, over and over and over, we eat the same foods over and over and over, the same foods from the same sources, and that can cause a problem, especially some more than others, like fried foods and cheese. If you want a child that doesn't like veggies or foods to eat, all they just put cheese on it. They'll eat anything, including dirt. Just put cheese on it. That's how people get over this hump, so to speak. Well, you don't want to do that. And many of the ice creams, they're garbage. They are chemical concoctions that are put together. I mean, you can scoop it out and set it on the table, and it'll take it an hour and a half to melt because of the retardants that are in it. But let me get back to this now. You just want to not eat the same foods over and over and over again. And I've got to come to the defense of cholesterol in this, because more often than not, doctors, advertisers, The commercials, all the pharmaceuticals, all blame cholesterol, cholesterol, cholesterol. That is bogus, bogus, bogus. When we break down blood clots and we tear them apart, it's like taking apart anything else. And you find out, this loaf of bread is 1/4 eggs, it's 1/3 water, it's 3/4 flour, and 2/4 whatever. Well, we break apart a blood clot. Please hear me very, 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 very clearly. When we break apart blood clots, less than 1/4, less than 4%, less than 4% of the total of a blood clot is composed of cholesterol. That means that 96% of a blood clot is made up of other agents. And I will tell you it's primarily proteins and sugars, but only 4% or less is made up of cholesterol. But for many, many, many years, I think since the 70s that I can remember, they have been sounding the alarm that it's cholesterol, 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 which is a lie, which is junk science, which is garbage. And I'm here to tell you the truth, because the truth is the only thing that's going to make you free. But getting back to my original recommendation, you just don't want to eat the same foods over and over and over again. You got to have variety, okay? And with that variety, you need to consider eating 4 to 5 cups of fruits and vegetables, especially the vegetables, not so much the fruits, but the veggies every day, see? And at least 1 or 2 servings of a nice fat fish about 2 or 3 times a week, see? 2 or 3 times a week, a nice fatty fish. And it's not the popular ones that you might think of, the cod or the halibut or the tilapia or lobster or crayfish. We're talking about mackerel, herring, anchovies, sardines, Atlantic salmon, those types of fish. Those are going to be very, very good for you. And if it's crisis intervention then you need to see your doctor and probably get on some type of a blood pressure medication just to use temporarily until, as a result of your actions, you lower your blood pressure naturally, okay? And when you do that, you can go back to the doc and say, hey, look, doc, my blood pressure is getting lower than it was when I first got on this med because of my diet change, my activity levels, and everything else. So let's get me off of this blood pressure medication. And having that conversation, I'm sure that he or she will agree with you. Okay? So with that dietary change, let's talk about weight loss, because like I said, obesity, as well as the complications that link to it, or overweight, because if you're obese, you have high blood pressure. If you're obese, you are either pre-diabetic or you are diabetic, type 2 indeed. And what that's going to do, that's going to raise your odds of having a stroke. That's it. Rarely does anybody die of type 2 diabetes. You can check it out. But those that have type 2 diabetes will die of heart attack, stroke, they'll die of other complications, other types of things happening rather than the type 2 diabetes. That's just the nature of the beast. So look, I'm telling you, if you're overweight and you don't change your habits, there's a good chance you're going to become obese. And if you get obese and if you are overweight, you are already in that stage of throes of becoming pre-diabetic or having what's also known as metabolic syndrome. And you are headed toward becoming a full-fledged type 2 diabetic and or having high blood pressure, the whole 9 yards, and that's going to lead to having a stroke. So you have the power, the wherewithal to stop it. Don't buy into it that you should embrace this and celebrate the fact that you're overweight and they have plus sizes for you now that look fashionable. Look, I know that these words may sting, but I'm here to tell you the truth, because the truth is the only thing that's going to make you free. So if you're one of those individuals and you need help, as I said a few moments ago, you call us. We're here to help you out. Because if you're overweight, losing as little as 10 pounds can have a tremendous impact. a real impact on on its ability to reduce your risk of having a stroke. Just 10 pounds. You can lose 10 pounds within a month. Easily, you can do that. And if you do, it's going to reduce your potential of having a stroke. And if you need a wake-up call, go out to some of these facilities that where people are that have had strokes, and look at the ones that are hemiplegic or paraplegic, and then picture yourself in their place. And I'm telling you, when you see that, it becomes a whole lot easier to take the responsibility back in your life, uh, especially when you're working with a doctor that'll work right with you. Okay, and your BMI, that body mass index, you find out what that is, and you work on reducing it. You just do that. You get rid of it. And the body mass index is the fat mass you have in comparison to the muscle mass you have, and the percentage of it is in your total weight makeup. That's what you got to do. So what do you want to do? You got to get into physical activity. Yeah, you got to get off your tuchus and start moving again, because exercise contributes to weight loss, and it helps to lower the blood pressure. And it can also be a standalone as a stroke reducer. Just by incorporating physical activity can be a powerful agent in keeping your blood pressure low or preventing you from getting high blood pressure. So, you can take a walk around the neighborhood. If you have a dog, let the dog take you for a walk every day, and which most of them usually do. Even though we say we're walking the dog, it's more often they're walking us. But get out there with your pup or your dog and walk around the neighborhood, your significant other, your husband, your wife, whoever, another family member, do it. And if you can't do that, well, I don't know, sign up to volunteer somewhere, or you can even sign up to walk other people's dogs. Yeah, there's apps today. You can get a part-time job if you want, walking the dogs in the neighborhood for other people. And if those other people for whom you're walking their dog ends up having high blood pressure or whatever, why send them to me. Or I'm just joking around, so don't get all huffy. But you can do that and try an exercise class, with your friends or whatever. Go down to your local Y and get into one. When you're out and shopping, park far away from the store instead of, driving for 20 minutes trying to get the parking place that's closest to the door. Take the stairs instead of the elevators. Do those types of things. Those will be beneficial in promoting a healthier life for yourself. That's what you want to do. And when you do exercise, you want to, when you're walking, you don't just want to stroll. You don't want to just, shuffle along. What you want to do is to walk at a level where you're starting to breathe hard, but you can still speak. You're kind of almost out of breath. You're huffing and puffing just a little bit, but you can still talk to the individuals that's with you. And try to do that at least 30 times a day. I'm sorry, not 30 times, 30 minutes a day. Well, wouldn't it be great? But, try to do it for about 30 minutes a day. And if you can't block out 30 minutes, because I know some of, you might be thinking, well, hey, but where am I going to squeeze in 30 minutes? Well, look, try to break it up. Do it 5 minutes 6 times a day. Do it 10 minutes 3 times a day. Whatever. Do it 15 minutes twice a day. But just get out there and do it. And when you do it, even if it's for the 5-minute level, you want to go ahead and get it to the speed. You want to walk at a speed wherein you're starting to huff and puff a little bit, but you could still talk to the person that's with you, or you can talk to yourself out loud. All right? So try that. It's going to help you, and it's going to benefit you tremendously, okay? So along with prevention, I want to talk to you also about the atrial fibrillation, because, boy, that's very popular on the TVs today. The atrial fib, it's a form, listen, it's a form of the irregular heartbeat. And remember, way back when we started it, the type of stroke you can have because of the clot being formed in the heart or another part of the body as a result of irregular heartbeats. Well, here we go. That irregular heartbeat is a form of atrial fibrillation. It's causing the clots, remember, also called thrombus. It's causing the clots to form in the heart. And what happens is they break off from the heart and they get picked up in the blood flow and they're pushed up into the brain and they produce the stroke because the clot is bigger than the tiny vessels of the brain. So if you know a person or you are a person that has atrial fibrillation, you are almost 5 times more likely to suffer a stroke. So the treatment you get for it should be taken seriously. What would I recommend? In addition to the medication, because we want crisis intervention, would be seeing a doctor of chiropractic in your area, because that type of doctor is specifically trained to ensure that the nerve pathway from the brain to every cell of the body is open, is intact, so that the electricity, and your brain literally generates electrical impulses, can be transferred over the nerves, of which the heart is one of those organs now that is receiving that. And the heart works on electrical conductivity. So if there's a problem, if there is some type of an aberrant obstruction or change in that nerve, or those nerves going to the heart, that impulse from the brain or from the heart to the brain might be disrupted, which is causing it to malfunction. So again, bottom line, see a doctor of chiropractic in your area, in addition to getting on your meds. If it's crisis intervention, getting that taken care of. And there's also sometimes types of foods, of which I'm not going to get into, that will contribute to that as well. But, as I said, you can contact us. We'll help you out in any way we can. But the atrial fib, you definitely want to deal with that. And then, of course, the diabetes. You don't want to manage diabetes just like you don't want to manage your house being on fire. You want to put it out. So having high blood sugar, what it does is, which is diabetes, high blood sugar, it's damaging your blood vessels over time. Remember about the cerebral hemorrhaging, where the blood vessels get thinner and weaker and whatnot? That's blood sugar wearing down those vessels. They're getting weaker, and then boom, the person's type 2 diabetic, but they died of a hemorrhage. They had a brain bleed or whatever. See, that's what I'm telling you. Most of the people rarely die of diabetes. They die of other conditions that come about as a result of being diabetic. But that's what you've got to do. The high blood sugar damages the blood vessel over time. It makes clots that are more likely to form inside them. And keeping the blood pressure, monitoring your blood sugar over time as directed by your doctor. That's a great start. But you got to get into it now. You got to change your diet. You've got to start exercising. The medications that you're using to control your blood sugar, those are causing damaging effects on your body. So the sooner you can get off of them as a result of the responsibility that you're assuming in changing your life, the better off you're going to be. And additionally, know that your risk for prediabetes, and that 1 out of 3 people are pre-diabetic. And I've seen this in my own clinical experience, people coming in. But doc, they said that I'm good and this and that, and don't come back until it comes a little higher or whatever. Look, you want to stop it right now. So if you go to your doctor, find out if you're pre-diabetic, ask them point blank, hey doc, I'm not diabetic, okay, but am I pre-diabetic? If I am, if you are, then do something about it, because 90% of the people that are pre-diabetic, they don't even know it, okay? So you want to do something about it. You want to stop it so it doesn't grow up and become full-blown type 2 diabetes, all right? And then, you got to quit smoking. If you're a smoker, you got to stop smoking the cigarettes, because they accelerate the formation of clots. Because what they do is they actually thicken your blood. See, it makes the blood very thick, which is going to increase the amount of plaque buildup inside the arteries, which also, by the way, if you have thicker blood, that means the heart's got to work harder to push the blood through the system, which increases your blood pressure. So you've got to quit smoking. It's one of the most powerful lifestyle changes that's going to help you to reduce your stroke risk, along with the exercise and the diet change, the quitting of smoking. Really, really powerful. And look, if you're a smoker, don't be afraid to ask for help. What worked for your friend, when your friend says, hey, I quit smoking and this is what I used, you might try the same thing your friend did, but it may not even work for you. So don't stop there. Keep looking for another answer in this or that, whatever it might be, the patches, the gums, whatever, hypnosis, whatever it takes, just do it. You've got to stop smoking. And for those of you that if you're vaping and you think that, I'm doing it, I'm enjoying the pleasure of smoking, and I'm not, getting any cancer from it, look, I got a wake-up call for you. You're killing your brain. You're killing your body. If you think for a moment that inhaling that chemical compound into your body, you're doing so without any risk or damage to your body, you are terribly mistaken. As the use of the vaping is increasing, so is the death rate as the result of it. So that even some of the companies now are being sued. And I don't know why, because, it's like a person who deliberately steps out in front of an automobile and gets hit by a car. They sue the automotive, the company that made the car. Look, the person that stepped out made the decision. They're responsible for their actions. So again, what I'm saying to you is, if you're vaping, make a quality decision, stop it, quit it, because it's killing you. All right. It's doing that to you, and you're more valuable than that. Look, I'm at the end of my presentation here. I want to thank you for allowing me to share this information with you. I want to thank you for for sharing your time with me. If you do have any questions at all, we invite you to email us at the email address office@pro-activewellness.com. I repeat that, office at the word pro followed by a hyphen, and then activewellness.com. Any questions that you might have, any way that we might be able to help you, you let us know. And please feel free to sign up for our YouTube channel, because what our goal is always to help you to achieve the best performance of your life. Hey, thanks again so very, very much for allowing me to share this information with you. And until the next video, and as always, God bless.